So today we're gonna talk about the sickle cell anemia. So if we'll talk about its introduction, as we know that it's an inherited form of anemia. So in this case, there are not enough amount of our red blood cell which could be able to carry the adequate amount of oxygen throughout our body, because as we know that the in the case of sickle cell anemia, it became in the shape of sickle and the crescent moon, which is of more rigid and sticky, which are not being able to pass through the small blood vessels, while in the case of the normal RBC, it's in biconcave in shape, and it's being more flexible and could pass through the smaller blood vessels also. So in this case, we could conclude that there is the presence of irregular sept, and it could get stuck in the smaller blood vessels, which might tend to slow or block the blood flow and oxygen supply to the part of the body. So if we will conclude about its introduction, in 1904, the Walter Helmut Noel traveled from Grenada to the United States to start studying at the Chicago College of the Dental Surgery. A few months later, he admitted to the Presbyterian Hospital at Chicago, where he developed severe respiratory distress and leg ulcer, both of which we know are symptoms of sickle cell. So, Dr. Ernest E. Iron, the intern, who was on duty that day, performed a routine blood test and a urine analysis for Noel, and was first to observe this pear-shaped elongated sickle blood cell. So it was not until 1910 that Dr. James Haddock, the supervisor of Dr. Iron, published the article describing this peculiar elongated and sickle-shaped red blood corpuscle in a case of severe anemia. This was the first documented and recorded case of sickle anemia in Western anemia. Uh, So, Dr. Noel returned to Grenada in 1907 and ran his dental practice in St. George, the capital city, until he died at the age of 32 from acute chest syndrome. So 1917, the genetic basis for sickle cell disease by Dr. V. Emil. The third case of sickle cell was described in 1915 by Cook and Meyer in a 21-year-old woman. Interestingly, blood sample from both the patient and her father, who displayed no symptoms, showed the suckling deformity of the red cells, and three of her siblings had died from severe anemia. So these observations by Dr. ML suggested a genetic basis for the disease, but also led to a period of confusion with the genetic of disease. So in 1922, the doctor via Mason names the disease sickle cell anemia. So if you will go for its hemoglobin, as we know that it's a oxygen carrying pigment, and it's predominant protein in the RBC. As we know that heme is made up of a heme that's being considered as a iron, and the another chain is of globin, that's the protein. So it's being as we know that a single hemoglobin being able to carry four oxygen. So, as we know that hemoglobin form an unstable reversible bond with oxygen. So, if you will talk about its oxyhemoglobin, that been differentiated by its color, that's oxygenated and will be bright in red, while in the case of deoxyhemoglobin it will be reduced and purple blue in color. So each hemoglobin molecule is made up of a four heme group surrounding a globe in group. So as we know that this four heme is being capable to carry one oxygen. So in a single hemoglobin unit, there being capacity to carry four oxygen. So heme content iron and give a red color to the molecule. So globin consists of two linked pair of polypeptide chain. So if we will talk about the genetic of sickle cell anemia, the change in the cell structure arises from a change in the structure of hemoglobin. So a single change in amino acid can cause hemoglobin to aggregate. If one of the parents had the sickle traits, that's been considered as a HbAs. As for AS stand for the sickle, and the other does not carry the sickle hemoglobin at all. So the normal would be HbA, then none of the children will have the sickle cell anemia. So there is 1 into 50% chances that any given child will get one copy of yes. So uh, so therefore there might be the presence of sickle cell trait. So it's equally likely that any given child will get two HbA gene and can be completely unaffected if both parents have the HbAs gene. So in that cases, one in the four, like there might be chances of 1/4 or the 25% of the chances that any given child could be born with the sickle cell anemia. So there is 1 in 4 chances, as I already concluded in the previous statement, that could be completely unaffected. So there is 1 in 2, like 50% chances that any given child will get sickle cell trait. So if one parents have sickle cell trait and the other have the sickle cell anemia, so there is 1 to like 50% of the chances of getting sickle cell anemia. So if you will conclude about its mechanism, it's give up its oxygen to the tissue, so it's stick together, so it's form long rods from the inside RBC, so that will make RBC more easy inflexible and the sickle is the trap. So it's been unable to squeeze through the small blood vessels and instead of block a small blood vessels. So less oxygen will be supplied to the tissue of the body, so that might also call to the cyanosis and some fatigueness to the entire body. So as we know that in the normal lifespan of RBC, it's been considered as 120 days, while in this case we can see the lifespan is just 20 days. So it's the chronic state of anemia. So if we will talk about its symptoms, it could be vary from person to person, so over the time. So it could include the anemic form, like in anemic form, its sickle mainly break apart easily and die, so leaving you without enough RBC. So as we already mentioned that RBC being considered for the 120 days of its lifespan before they need to be replaced. But in the case of sickle cell, it tend to be dying within the 10 to 20 days, so leaving a shortage of RBC cells, and our bone marrow and is not being capable to uh, compensate with such shortage of the RBC. So without enough oxygen, red blood cell, our body can't get enough amount of oxygen, and it need to feel energized, and that gonna cause fatigue to our body. So there might be also episode of pain, and in this case there will be periods of pain that might be called as crisis, are a major symptoms of sickle cell anemia. So pain developed when sickle shaped RBC block blood flow through tiny blood vessels to your chest, abdomen, and the joints. And pain can occur in the your bone also. That might be differential diagnosis, because we might confuse with some other osteopathies also. So the pain varies in intensity and can last for few hours or a few weeks. So some people have only a few pain episodes, so other gonna have a dozen or a more crisis in a year. So if a crisis is severe enough, or you might need to be hospitalized. Some adolescents and adults with sickle cell anemia also have chronic pain which can result from bone and joint damage and ulcers and other causes. So there might be also the presence of painful swelling and fits. So the swelling is caused by sickle cell red blood cells being that being blocking the blood flow to the hands and feet. So there will be also frequent infections. So sickle cell can damage an organ that fight infections like the spleen, and leaving our body vulnerable to the infection. So it our body will be more potent to the infections. So doctors commonly uh, give you um, give infant and children with sickle cell anemia vaccination and antibiotic to prevent potential life-threatening infections such as pneumonia. So we could conclude that to exhibit or to eradicate the complication, we must vaccinate and provide the adequate amount of antibiotic to the patient to just go out of through the complication, and so that it doesn't go the more severe, and it could be treated more easily. So there might be also delayed growth due to some decrease in the supply of oxygen to the body and the nutrient that's need our body. So it's not gonna be delivered properly. So there will be shortage of healthy RBC and can slow growth in infant and child and may delay puberty in teenagers. So there could also be vision problem could be possible, like the teeny blood vessel that supply our eye may become plugged with sickle and gonna be make a sludge over there, and this can damage the retina, the portion of the eye that processes visual images, leading to vision problems. So if we'll talk about such complication, there might be a stroke, mm, that can occur if sickle cell blood flow to an area of your brain, and the sign of a stroke could include seizures, weakness, numbness of your arm and the leg. So there might be also a perceiveness of some speech difficulties and loss of consciousness. So if a baby or a child have any of these symptoms, signs and symptoms, should immediately seek to the treatment or hospital, and a stroke can also be fatal in this case. So acute chest syndrome could also be life-threatening complications, and the fever and difficulty breathing could also be conclude in this complication. So acute chest syndrome can caused by a lung infection or by sickle cells blocking blood vessels in your lung. So it might require emergency medical treatment with antibiotic and other treatments. So pneumonia, hypertension, pulmonary hypertension, people with sickle cell anemia can develop high blood pressure and in their pulmonary hypertension. So this complication usually affect adults rather than the children. So shortness of breath and fatigue are commonly common symptoms of this condition, so which can also be fatal. So we could also find some type of organ damage. So sickle cell that block the blood flow through our blood vessels, so immediately deprive the affected organ uh, of the blood and oxygen. So in sickle cell anemia, blood is also chronically low on oxygen. So chronic deprivation of oxygen rich blood can damage nerve and organs in your body, so including our kidney, liver and spleen. So organ damage can be fatal. So if you conclude talk about the blindness, the sickle cell can block tiny blood vessels that can supply your eye over time. So this can damage the portion of the eye that processes visual images on the retina and lead to the blindness. And we could also find the leg ulcer due to the insufficiency of oxygen supply to those part or lower limb. So that can cause open sores and might lead to the ulcer on your leg. And we could also find the gallstone, that the breakdown of the RBC that can produce some substances like the bilirubin, and high amount of your bilirubin may lead to the gallstone. So for its diagnosis, we can go for the blood test and check for the hemoglobin S, like HbAF. If we will find the HbS, means there is the presence of S, stand for sickle in the hemoglobin. So in United States, the blood test is a part of routine newborn screening done at the hospital, but older children and the adult can be tested also. So in adult, a blood sample is drawn from a vein in arm. So in young children and babies, the blood sample is usually collected from a finger or the heel instead of taking no, from the vessels from the hand. So we must choose the finger or the heel. So if a screening test is negative, there might negative probability of getting the sickle gene. So if the screening test is positive, further test will be done to determine whether one or two sickle gene are present. So that could be the part of severity, and check for or the probability of having the sickle cell. So check for a low red blood cell count will be done. So if we'll talk about genetic counseling, we must to go through two tests that being used to help expectant parents. So first is the amniocentesis. In this case, usually at 14 to 60 weeks of pregnancy, tests being uh, taken for test we need to take the sample from the amniotic fluid from the womb in genetic defects, and we need to find the fluid and fetus wanna have the same DNA. So usually local anesthesia, a thin needle is being inserted through the womb and abdomen and into the womb, and about 20 millimeter of fluid, roughly 4 teaspoon, is being withdrawn and sent to a lab for the evaluation. So this result often take 1 to 2 weeks. And the second test we can do the chorionic villus sampling. In this case, involve a removal and testing of a very small sample of placenta during the early pregnancy. So the sample which contains the same DNA as a fetus is being removed by catheter or a fine needle being inserted in the abdomen. So the tissue is tested for genetic changes identified in an affected family member. So results are usually available within just 2 weeks. So if we will talk about such treatment, usually it's aimed to avoid the crisis. So we must relieve the symptoms and prevent the complications. So babies and children whose age is below than 2 or being till age 2 and younger with sickle cell anemia should make frequent visit to a doctor. We shouldn't be delayed in this case. So if the children is older than 2 and the adults with sickle cell anemia should see a doctor at least once a year to gather the knowledge that if they it's gonna aggregate or gonna have more complication or it will be normal in that case. So it's according to the Center for Disease Control and Prevention. So if you will talk about its medication that tend to reduce the pain and prevent complication and blood transfusion, as well as bone marrow transplantation is being considered as the last treatment. So we can start with the antibiotic, like children with sickle cell may be given uh, taking some antibiotic like penicillin when they are uh, about 2 month old, and might continue taking it until they are at least 5 year of the old. So we must give it for a prolonged period of time. So doing so help prevent infections such as pneumonia, which could also be life threatening uh, to an infant or a child with sickle cell anemia. So as an adult, if you have your spleen removed, had pneumonia, you might need to take penicillin throughout your life to exhibit all those complications. So we can also go for pain relieving medication just to relieve the sickle cell crisis. And we can also give the hydroxyurea like hydroxyurea or hydrera, which taken daily. Hydroxyurea reduces the frequency of painful crisis and might reduce the need for blood transfusion and hospitalization. So hydroxyurea seems to work by stimulating. So we can also do treatment by assessing the stroke risks by usually using a special ultrasound machine called as transcranial. So doctor can learn which children has a higher risk of stroke. So painless test which uses sound waves to measure out blood flow and can be used on child as young as 2 years. So regular blood transfusion can decrease the stroke risk, as we know that in this type of ultrasound machine there will be no non-invasive mechanism of investigation. So uh, we can also go for the vaccination to prevent the infection. So childhood vaccination are more potent or important for the preventing the disease in all the children. So vaccination such as the pneumococcal vaccine and the annual flu shot also being important for adult with sickle cell anemia. So we can also go for the blood transfusion, and RBC are being removed from a supply to donate the blood and then given IV to a person with sickle cell anemia. So blood transfusion may increase the number of normal RBC in circulation, so helping to relieve anemia. The children with sickle cell anemia have a higher risk of stroke. So regular blood transfusion can decrease the risk. So transfusion can be used to treat other complication also. So they can be given to prevent complications. So blood transfusion carry some risk, like including excess iron buildup in your body. So because of the excess iron can damage heart and more important organ like liver and other organ, so which undergo regular transfusion might need to treatment to reduce and maintain the iron level in the body. And the last treatment gonna have be the bone marrow transplantation. In this case, it gonna be the stem cell transplant, so offer the only potential cure for the sickle cell anemia. So it's usually reserved for the people who is younger than the 16. So because the risk increases for people older than the 16, so finding a donor is quite difficult. So and the procedure gonna have the very serious risk factor which is associated with it. So it gonna also include the death. So a bone marrow transplant gonna involve replacing bone marrow affected by sickle cell anemia with some healthy bone marrow from a donor. And procedure mainly uh, uses a matched donors such as the sibling which doesn't have the sickle cell anemia. For many donor are not available, but the stem cells from the umbilical cord blood samples blood might also be an option. It could be used as a curable blood. So, because of the risk associated with the bone marrow transplant, the procedure is recommended only for the people, usually children, so who have significant symptoms and problem from sickle cell anemia. So, if a donor is being found and the people with sickle cell anemia revive radiation or the chemotherapy to destroy or reduce his or her bone marrow stem cells, so healthy stem cells from the donor are being injected intravenously into the bloodstream of the person with the sickle cell anemia, where they migrate to the bone marrow and may also begin the generating new blood cells. And in this case, they gonna be all right or might have some little of the complications. So the procedure required a lengthy hospital stay, and after the transplant, you will receive drug to prevent the rejection of the donated stem cell. So even so, you body might reject the transplant, leading to a life-threatening complication and may also be very fatal to the patient. And nowadays, the experimental treatment is also in life. So gene therapy is one of them. So nowadays, researchers are exploring the whether inserting a normal gene into the bone marrow of the people with sickle cell anemia will result in normal hemoglobin or not. So still it's in research in experimental field. We can't consider it as a proper treatment. So scientists also exploring the possibility of turning off right effective gene, so while reactivating gene responsible for the production of fetal hemoglobin. So a type of hemoglobin being found in the newborn that prevents sickle cell from forming. So potential treatments, usually gene therapy, are a long way off. So however, although several of the initial hurdle of the sickle cell disease, gene therapy appear to have overcome. It is prudent to recognize barrier that remains. So efficient transduction of the HSCs, the lentiviral vector that became increasingly reliable but complicated component of the many globulin vector, is being present unique challenges for the production of higher tiger virus being capable to robust transduction. So still it's a challenge for the scientists to make it more compiled for the patient. So scaling a procedure to multiple patient in a non-trivial challenges. So safety and efficiency can also be established by careful clinical trials with ex- with with extended patient follow-up. So gene engineering method are rapidly evolving and should facilitate development of second generation gene therapy approach the coming years. So after many years of preclinical laboratory investigation, gene therapy options are now on the horizon for the patient with sickle cell diseases. Thank you.